Hi everybody, my name's Amanda Lee. I'm Dr. Amanda Lee. I am Senior Lecturer in Nursing in the School of Nursing and Public Health. I come to you today as somebody with an eclectic leadership experience, leadership and management, and I'm going to talk to you a little bit about that today. I started nursing when I was 17. Nursing's always been an absolute passion from being about 3 years old. I felt that was exactly what I wanted to do. And I've had an absolute diverse career, and it's taken me to a number of different countries, and I've thoroughly enjoyed every second. I'm an editor for Nurse Education in Practice, and I'm also a visiting professor in a Chinese university in Yangzhou, which is in the Jiangsu province of China. Started nursing in 1988, many years ago, when nursing was just certificate level. So if you got your GCSEs, you could go directly into nursing when you were old enough, which was fantastic. Started getting really interested in nursing leadership as I moved through the ranks and started thinking, oh, maybe I am a leader now. But when I look back and reflect on my own actions, which of course we're always taught to do through the NMC code, I realised that perhaps I've had some leadership traits all the way through my career, and each and every one of you today will have those leadership attributes inside of you as well. The greatest thing about nursing is, if you're pursuing a career in nursing, you're already possessing levels of emotional intelligence and levels of care, compassion, commitment, which are required to make you an excellent leader. So I hope today my experience will help you a little bit. So when I started, I was always taught qualify, specialise, diversify, and that's exactly what I did. So I qualified in 1991, specialised, I went straight off to neonatal care and specialised in that one. But then I went off to Saudi Arabia, became a nursing sister in Saudi Arabia for a little while, enjoyed travel and life and everything that has to offer as a 20-something-year-old young nurse with lots of opportunities, because nursing gives you lots of opportunities. And then I moved across from Saudi once I'd completed that, travelled for a little while, and then returned to the UK, where I decided that the best place for me would be to undertake a degree. I did my degree in midwifery, which was fantastic. And it was really interesting going back to being a student, but having been a neonatal sister on a ward. So I remember at one stage a midwife pushing me away during a delivery, thinking I was just a student. And actually, I'd been a neonatal sister for many years, so I got a fair bit to answer to that one. So we reflected on that at the end of the event, and most importantly, the baby was absolutely fine. Anyway, after the midwifery, I went off and did a couple of other programs, a little bit more specialisation, and I became an advanced neonatal nurse practitioner by the glorious age of 29, which was fantastic. I mean, these, band 8 by the age of 29, obviously I was doing something correctly. Some of the key things that I was doing that I think were correct was, when I found a patient with a condition that I didn't know anything about, I'd go off and find a paper on it and I'd read it. If I found that something was awkward or uncomfortable or a situation that I wasn't sure about, I'd ask the questions, and I was never scared to put myself forward to ask. And I hope to goodness you guys are all going to be just the same. Try and read a paper on every single patient, and what you'll find is, rather than trying to cram for exams, trying to cram for absolutely everything, you just generate that knowledge nice and slowly, and that offers you a wisdom, a heuristic framework to be able to develop and lead yourselves as you go along. Leadership, to me, is always about the teams that we have around us. Leaders innovate, leaders inspire. When I was an advanced neonatal nurse practitioner, some of the things that we did as a team were identify some of the problems that were happening. So we ANPs would go off and do all the resuscitations for the babies. And what that meant was the midwives weren't getting an opportunity to learn and to develop and to experience. So we developed a program whereby we could do that sort of stuff. So an innovative practice, which actually resulted in the midwives really feeling that they were part of our team and we were part of their team. And then they also could pick up cues that were really relevant to nursing practice, midwifery practice. So that was really good outcome from that particular role. There were many, but that was just one of them. I then moved to Australia for family reasons. I decided I've got young children and I wanted to sort of experience a lifestyle out there. And of course, nursing, it offers the possibilities to travel. It offers that opportunity and it's great. So I did that and I seized all the opportunities I could. So I went across to Australia. I thought I was going to be a little bit more sort of housewifey when my twins were little and my boy was little. But then I sort of fell into academia, where I ended up running the nurse practitioner program over there. Now, nurse practitioners in Australia are registered, they are professionally registered, ratified, they have to do a separate master's degree in nurse practitioner, and they're recognised by the Australian Nursing and Midwifery Council as such. They can also prescribe and diagnose. So I did the program, I did the master's degree course, and then ended up running it and teaching it. While I was running and teaching the Master of Nursing nurse practitioner, I worked really closely with the Australian government because it was a new, innovative role. I worked really closely with the Australian Nursing and Midwifery Council, again, because we had to establish standards and develop and implement standards for practice for nurse practitioners. But I also realised I'd started with a programme of about 30 students and I ended up with a programme of 135 students. So the programme became very, very successful. Part of, again, working with a marketing team that was fantastic. But what it meant was that, once we trained these students, where did they go? How did they get employed? So I found a private investor and I worked with the private investor, and me and her set up the first ever nurse-led clinics. First one was in a little place called Burragoon in West Australia, in the middle of a shopping centre. But I was thinking ahead, so I made sure that I designated the whole of West Australia to be able to ensure that we could then expand the whole clinic situation. It ended up expanding all the way throughout Australia. Unfortunately, I just went for consultancy fees. I should have gone for shares in the company because it sold for multi-millions of pounds. But anyway, you live and learn and reflect as time goes on. After having done that, one thing that I did notice was where you live in Australia really mattered as to how you got healthcare. And I think that's also a situation in the UK. And I'm going to come back to that in a little while when I talk to you about my PhD, just really briefly. So having worked in Australia and run the programme for 7-8 years, I decided to return to the UK. Family reasons, you get to a certain age and realise that you need to be closer to the family. So I did that, and it meant I started again from scratch. So I'd been a neonatal sister, went back down to being, went back to being a student and resumed that level. And then I'd gone off to Australia, gone all the way up. So I was working with governments and Australian nursing and midwifery councils. And I went back to the UK and ended up working for a couple of months in a nursing home. And then I was fortunate to get a job in the University of Hull. Started as a lecturer in the University of Hull, moved through to senior lecturer, and then associate dean as well, which was fantastic. So again, associate dean. I've always fallen into these positions. Well, actually, no, I think some of the traits that I have made sure that I have got those positions that I've needed to get, and I've done a decent job. So as Associate Dean International, I set up the first ever dual degree nursing in China. And that meant that we had flying faculty going from Hull University out to China to deliver an integrated curriculum with China. What that meant was I had some brilliant leadership support. So I was very, very lucky to have a life coach and a leader who looked after me and helped me to manage this very, very large project. The project consisted of setting up the dual degree, writing the curriculum, working with the Australian Ministry of Education, working with the Department of Health, working with the host institution, and of course within the boundaries of the University of Hull. So significant amounts of little things that I had to do. So I developed work streams. And this is a really great approach for anybody that's thinking about managing any small projects. Develop work streams, find out your strengths and your weaknesses of all the staff within those work streams and play to them and work with them. I'm absolutely terrible at some things. I'm really good at others. And it's exactly the same for many, many other people. So what you have to do is just integrate the teams, find out what their strengths and weaknesses are, talk to them, see what inspires them, and give them the jobs that are commensurate with that level of responsibility. And this goes for your nursing as well. You know, when you start running wards and even when you're running your own bays and your own sort of managing style of patient loads, it's about doing that. It's about managing all of these people to the best of their abilities. You know, I think some of the best leaders that I've had are the cleaners on the neonatal unit that I used to work with. And I used to make them a coffee when they were really busy, and they would make me a coffee when I was busy. And we would just integrate and work together. I would help them, they would help me. And it's about just that quid pro quo. You know, nobody's better than anybody else. We're all there to do a job, and we're there to do a job for our patients. So that's my values, I guess, as far as leadership. But while I was setting up this dual degree in China and doing all of the Associate Dean International work, I also did my PhD. And my PhD used cancer data and cancer statistics to predict areas of need for healthcare intervention. So I used patients' postcodes in Hull and the surrounding area to identify the sort of types of people that lived within those postcodes. And then I mapped the cancer data and showed how and where we needed interventions to start earlier interventions so we could get more people earlier on for diagnosis. We had, I worked with the consultants and the regional referral team in Hull and East Yorkshire. And what we did was we organised some sort of teaching sessions and teaching plans across the GPs and the communities and the nursing district nursing fora. So then that way we could also help with, you know, where people were so that we could intervene and start to instigate earlier intervention strategies to get patients diagnosed earlier. And I've since worked with Leeds trauma unit as well and done some work with those and some research with those as well to identify the best area to go for a trauma centre. So after I'd done my PhD and after I'd been working as an Associate Dean International, that opened up some other opportunities, which was fantastic. But what I did was I moved to private industry and I went into a management position. Management and leadership is very, very different, I think. I think leaders inspire, innovate, they have time to think and to consider strategy, and they have time to inspire their staff and make sure that everybody's congruent with a system and societal goals or departmental goals or whatever. But managers have KPIs, they have outcomes, they have different things that they have to manage. And so I took a time out and I started doing a dean's position for a little while. I did that. I must have been okay at it because I was upgraded to executive dean. And that saw me doing a new collaboration with a different university, Oxford Brookes, for health and social care. It even saw me meeting up with the Prime Minister at one stage, Boris Johnson. So that's an interesting way forwards. Again, nurses as politicians, we have to make sure that we drive the agenda forwards for nursing. I was dean, not just of health and social care, but also business and enterprise. And that gave me a real sort of interdisciplinary ethos. And it made me realise that if you're a leader in business or a manager in business, you're far more, the traits are slightly different. Leaders in nursing, we use more of a, I think we use more of a personable approach. And I certainly do, because I draw on the stuff that I would do. My communication with patients is just as essential as my communication with any of my peers, any of my colleagues, any of my managers, and any of my anybody within my teams. So after I finished with the private institute, I sort of left and worked and moved back to Manchester Metropolitan University because I'm really inspired by research. Now I've got over 50 publications in peer-reviewed journals, which is great. I work really hard. I love the research. I love to inspire people by publications, by research, and I love to bring that into the classrooms. My PhD draws from statistics and quantitative data analytics because I wanted to do something slightly different, slightly off kilter, and that using, identifying areas of need for healthcare intervention is pretty key. I had to use geographical information software, so I had to work with geographers, I had to work with the Office for National Statistics, I had to work with clinicians, and then data analytics to formulate how to do my research and to develop this innovative methodology that I did as part of my PhD. So there's a few things that I've done in my life, and I could go on forever and talk to you about what all that is. But I think the most important part of all of this is my leadership style, my leadership philosophy is drawn absolutely from nursing. Leaders are congruent leaders. We are all working together as part of a team. We have, as nursing is a values-based profession, congruent leadership offers a values-based leadership style and an appropriate leadership style. And I've published with the seminal author, David Stanley. I used to work with him in Curtin University. And this is his theory of leadership. The one thing that I think we all need to do is make sure that we align all of our actions with our NMC code, with our professional standards, with our professional requirements and etiquette. We offer care, compassion and commitment and challenge to make sure that we deliver excellent care. And that's what successful nursing leaders do. I hope you've enjoyed this and hope to see you around.